The one constant hotspot in this COVID-19 pandemic, which has claimed more than 82,000 American lives, almost 1,500 more than yesterday's grim total, is in nursing homes, roughly 30,000 nationwide. But the patients aren't the only victims here. The precious healthcare workers who care for our elders are at great personal risk as well. And here with me to discuss that situation at hand is Dr. David Barile. I hope I'm pronouncing that correctly. Founder and Chief Medical Officer with the Goals of Care Coalition of New Jersey. Welcome, Doctor. Thank you.
Thank you for having me.
All right, so we deal with the facts, we deal with the figures and the science of the pandemic, but please tell us the number of victims thus far and where the hotspots are in these nursing facilities.
Well, yeah, I mean, I'm calling from New Jersey now, and I can tell you that in our state, we've had about 10,000 deaths, sadly, and over 5,000 have been in long-term care facilities. So in our state, in New Jersey, it's about 50% that are in our deaths that are in long-term care. Across the nation, it's about 1/3 of all of our deaths.
That's an absolutely frightening number, staggering. And it all, I guess, started at that nursing facility in Washington State and has spread throughout. New Jersey has been particularly hard hit, though, in this area so far as flattening the so-called curve. They're trying to do that. Is that happening? And why is the number so high there?
Yeah, good question. So our curves for the general population in New Jersey are certainly getting better and flattening, but they're sadly, it's a straight line going up with regards to those in long-term care facilities. And that's for a number of reasons. Sadly, everyone knows that this virus spreads in a very insidious fashion. So you can not have symptoms and come to work, and before you're even tested or get sick, you're spreading this virus. And a lot of the healthcare workers that work in these long-term care facilities, nurses, aides, they have more than one job, right? They're working really hard to support their families. They leave one nursing facility and go work at another that evening or the following day. So there's spread there. And it's been really hard to contain, and very sadly, frail elders are very susceptible to this virus. As you know, it's one of the most vulnerable populations.
And you know what? There are nursing homes for sure. There are also health and rehabilitation centers where people recovering from various maladies, surgeries, procedures, injuries go for care as well. Is this an issue with these places also?
Absolutely, yeah. Most states like New Jersey have their rehab facilities combined within so-called nursing homes. So nursing homes are places where people live there long term, and many nursing homes have wings that are for subacute rehab after you leave a hospital. Then you'll come there for your rehabilitation services before you go home. And that also has been a mechanism for infections in the nursing homes, because people will be sick, they'll leave the hospital and they'll come into the nursing facilities and spread the virus. It's been really, really difficult to contain. And what we need now, I think what the biggest problem now, the challenge, and we heard in your previous piece there, the governor of Florida mentioned this, the challenge will be, how do we open them up? How do we allow these residents to come out of their rooms, back into the common dining areas? How do we allow their loved ones to come visit without spreading the virus? The biggest challenge now, I think, for your viewers to understand, all of the long-term care residents that are in nursing homes now, previous to COVID, they would come out for breakfast, lunch, and dinner and eat in a common dining area. Now everyone is in their rooms, and they have a major, major staff crisis in all of these nursing homes. We don't have enough staff to come in to feed them and care for them, do their basic activities of daily living, and they're cloistered in their rooms. So a big problem is staffing crisis, and second real challenge moving forward is, when can we loosen these restrictions?
I've cared for someone in a nursing home, have many of us. It's very tough. And one of the hardest parts for the person caring for the person in the home is entrusting a family member's care to a stranger, somebody you do not know. What are the concerns, though, you have for these precious caregivers?
Yeah, it's unfortunate. You know, I work in a nursing home half of the day, and I work in the hospital setting the other half. And you know, for all we hear in the news, all these people working in the hospital settings, from the people who are cleaning the floors to the delivering the foods to the doctors and the nurses and everyone, they're all so-called heroes, right? And we're so grateful for them, for their hard work. And it upsets me very much that we don't sing the same praises for those people working hard in the nursing home industries. Instead, they're sure shamed and fingers are pointed at the unfortunate situation that is occurring in nursing homes across the country. So these folks are working just as hard and are just as brave as those people coming to the hospital setting. We need to support them. I think the most important thing is that we get more staff into these buildings to help. So here in New Jersey, we called out the National Guard. We're getting some limited help from the National Guard, but we need a lot more help across the nation.
Doctor, here, and I second that very, very strongly. Thank you so much for joining us and for your expertise. We wish you well and hope that you stay safe, sir.
Thank you.
Thank you.